In New York, hospitals serving minority and low-income communities hardest hit by the coronavirus are facing crumbling infrastructure and few resources, unlike their wealthier counterparts. The New York Times reports that the University Hospital of Brooklyn, a publicly funded hospital whose patients are mostly poor and people of color, had to turn to GoFundMe to raise money for protective gear and testing kits. Compare that to wealthier hospitals that have been able to use their reserve of cash and political clout to quickly increase patient capacity and acquire protective gear. In one instance, the Mount Sinai Health System was able to use private planes owned by Warren Buffett's company to fly in N95 masks from China. This is just one example of how the coronavirus is exposing not only health care, but wealth disparities in one of the hardest hit cities in America. New York Magazine is out with a new issue on this divide with a cover story that asks, are you rich enough to survive this pandemic? And contributing editor for New York Magazine, Lisa Miller, joins us now. She writes for the issue a piece entitled The Space Between Us. And Lisa, I guess my first question would be, what's the biggest divide revealed by this virus?
I mean, in deaths. People of color are twice as likely in New York City to die of coronavirus than white people. And that's for all of the reasons that we already know about inequality. You know, Governor Cuomo said that the coronavirus was the great equalizer, but actually it's the great unequalizer. Poor people tend to live in closer quarters. They tend to have worse access to health care. They tend to have, because of that, more underlying conditions. Underlying conditions are correlated with fatality for the disease. So it's, you know, it's just an absolute lens into how unequal our city really is.
And what are you finding in terms of the wealthy being able to survive the virus at a higher rate? And are they, because they're more able to leave these hot spots?
Right. Well, the essay I wrote was sort of my own reaction to seeing my friends and my colleagues on Zoom, obviously in their country houses or wherever they could go to, and thinking, you know, there's so much judgment, there's so much reaction, there's so much of sense of betrayal. And what I ended up with was this idea that, like, to live in New York, if you're a certain kind of person, a striving, affluent, ambitious person, requires a certain kind of blindness to the inequalities among us. We walk into rooms, we go to parties, we go to bars, especially when we're young, and we see everybody, and we feel like we're part of this, like, big human crush. You know, we love the mix, we love to be like next to people, and then we understand in a crisis like this that those with the means leave, and those without the means stay. And, you know, over the last 20 years, stratification in New York has never been higher. And so those with the means really have a lot of means, leaving a lot of people behind.
You look at our healthcare system in general. You could, obviously, we've seen this our adult life, where if for some reason you or a loved one has to go into an emergency room at 10, 11 o'clock at night, there are a lot of single moms, poor single moms, who are having to use an emergency room as their primary care physician. I'm just wondering whether what's happened during this pandemic, not just the stark disparity that you're speaking of, but also sort of the tele-doctoring that's going on. I wonder if this may be a positive way forward for us to be able to get health care access for even those who don't have the best health care.
I mean, I think yes and no, right? I think that we'll find that a lot of the procedures and processes that hospitals need to have delivered in the past can actually be done through telemedicine, but I don't think that there's any substitute for a doctor's visit or a general practitioner, or somebody like looking at you, examining you, putting their hands on you. That's part of what doctors do. And I think a telemedicine approach is just inferior to that. I think again, it's an illustration of inequity, right? Because a lot of hospitals have charged a lot of money for unnecessary procedures in order to make money, right? And a lot of people can go do telemedicine instead of that. But there is no substitute for seeing your doctor.
Yeah, no doubt about it. And of course, thank you so much for being with us, because of course your piece really has highlighted the disparity, the great disparity between rich and poor, the two Americas that we've had for quite some time. But my gosh, if you just look at the death rates, like you said, Lisa, this pandemic has really underlined it in ways that we can't ignore. Lisa Miller, thank you so much for being with us. We greatly appreciate it. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.